And I will also start sharing my screen. That's not what I have to do. Let me try again. And this is the one that I want. Okay. Let's get rolling here. All right, everyone. Welcome to the Healthwise WebMD Ignite Social Driver of Health Task Force. I put this together with my colleagues, and I'm really excited that Lord Grobecker is joining us today. She has extensive experience in integrating Healthwise content into all the various parts of the Epic ecosystem. And so we can discuss how we're going to distribute this new content that has been developed in the form of patient instructions and Knowledgebase, and all the different places where it's possible to distribute information to the patients who you serve. And these are the different organizations that were invited to participate and expressed interest in collaborating on this. So thank you to all of you who expressed interest and showed up today to contribute. I believe that this is one of the great things about the Healthwise WebMD Ignite organization is that it's almost like a cooperative where we can learn from each other and share best practices. And so I'm excited that you all have joined us today. So here's the agenda of what we're going to be discussing. We put this agenda together after having various conversations with our client base and some questions internally about how is this information that we've produced going to actually help organizations with promoting and raising awareness around social screening and the subsequent interventions that you are offering the people that you serve. So any questions at all about this agenda so far? All right, hearing no questions, I'm going to keep rolling here. So what is our activity at Healthwise WebMD Ignite? We embarked on a strategy to make sure that you are able to have successful activity around SDoH screening, and that was within our health equity strategy that I've been really focused on the last couple of years. And so since you are required to do screening, and it's an important part of how you are going to help people improve their health, as an organization that helps to engage patients and inform them and involve them in your care, we decided that it was important for us to produce materials that you can use with your patients so they can understand what is this? Why is my healthcare organization asking me questions about my social circumstances because I'm coming in for knee pain. I'm not really sure how this relates. So, we really feel like it's going to be helpful to explain why organizations are asking these questions and providing these services. We wanted to do this in a way that had all the same knowledge engineering capability that you've come to expect from Healthwise so that the content can be surfaced in a contextually relevant way in the workflow of healthcare professionals so that it can be sent out to patients at various times. And so I think the key thing in this meeting is figuring that piece out. Does the knowledge engineering, does the way that you integrate the material really make it easy for you to distribute it? And then ultimately, does it improve the things that we're listing out here around the rates of screening? And then if you identify people who have needs, is the material helping you successfully refer people or provide services if you provide those yourself? So any questions at all about what Healthwise has been up to in this area? Is that pretty clear?
David, hi, it's Liz from Modfair. How are you?
Good. How are you?
Well, thanks. Doing well. I'm sorry if you said this. I had to step out for a second. Can you talk a little bit more about number 3 here?
Yeah. So we engaged with EMI Advisors, one of the organizations that was really instrumental in ramping up the Gravity Project. The Gravity Project is one of those HL7 accelerators with stakeholders from across the health, IT, and social care enterprises that did two things essentially. The Gravity Project established what are the codes that are going to describe all the different aspects of social circumstances, social care, questions, responses, observations. You can think of it almost like a laboratory observation. So getting the codes kind of standardized and corralled was one priority of the Gravity Project. And the second one is how do you structure messages if you're going to refer a patient to another department or some place where they can receive social care. But the coding that EMI Advisors did with that group was really important to Healthwise because our clinical folks who work in knowledge engineering and our knowledge engineering staff looked at all the value sets related to social drivers of health and said, okay, we need some guidance to figure out what are the domains, how are they described? There are almost a dozen different domains, and what are the different things that you can describe within each of those domains? So, for example, within food insecurity, what are the types of questions and responses and results that you might get with that? And so that coding expertise went into all of the metadata that surrounds these patient instructions and knowledge-based documents that are now on offer to you to help you integrate the content where it needs to go. Does that answer your question?
Thank you. Yes.
Okay. All right. And so what are the goals of this task force? After discussion with many clients, it became clear that there are possibly different ways to integrate and use Healthwise material on this type of content that is different from other types of integrations and workflows. So this is a different type of care. It's a different moment in time when it might be most effective to inform people about these concepts. So it's maybe not as straightforward as, oh, here's the content we want to provide at bedside in an inpatient setting, or here is the material that we would want to provide upon discharge from an emergency department. And so that first piece is to really have a good understanding of what are the approaches that make the most sense for this type of information that probably needs to go to the population that you're serving before they encounter some of these questions that will be posed to them. And then in addition, once you have a finding or a diagnosis, the way that you distribute information to support an intervention might need to go to a different type of care professional. a community health worker, a social worker, someone who may not typically be in the process of providing patient engagement material. And another thing that came up here in the second item is a desire among some of you to make slight changes to the patient instruction material because you had other activities and other communication flows that were directing people to certain resources to receive social care. And I think particularly at Honor Health, you all were really concerned that you didn't want to give too many directions to patients to go to 20 different places. We want to kind of put people on a glide path towards the things that are going to be consistent across your whole effort to get people to receive the right care. The third item there we want to discuss that we haven't really had a chance to talk to you very much about is that those patient instruction materials, the similar documents are going to be available in this springtime release in the May timeframe for the Healthwise Knowledgebase. And so those knowledge-based documents are going to be really useful for certain types of integrations where patient instruction maybe is not the right document type, or it's not as easy to link to a patient instruction where because the knowledge base tends to be on a website out on the internet, that may be a more appropriate document type and container for that content for you to use. And then lastly, we want to have a little bit of discussion about how can you measure the impact of the use of this material so that you can demonstrate to your colleagues, your leadership, that these things can be really helpful to people. I'll stop here and just ask you briefly any other goals that folks have around what they want to get out of this workshop today. I'm going to, before we jump into the content and get oriented around that again, I want to tell a brief story. So recently, I was invited to give a lecture to Mayo Clinic medical students in a class on health equity. And I talked about this type of content intervention that I said to the med students, when you are meeting with patients, you are in the future, you're going to be asked to assess or address the social conditions that your patients are experiencing because, as we have learned, we've known this for a long time, but it's become even more apparent, especially during the pandemic and other types of events where we have observed unwarranted variation in health status because of the structural things in our society, things like racism and other things that cause people to be treated differently. And it was really, I mean, it's not unexpected, but I was kind of shocked by the degree to which these medical students were unnerved, I would say, by the prospect of not just focusing on the biomedical things. Many of these students at Mayo Clinic are going to become orthopedic surgeons or oncologists and provide specialty care. And one of the students asked me, how is this relevant to me? I'm going to be providing tertiary care and performing joint replacements. I see this as something that's maybe more appropriate for primary care or population health. And what I'm learning to do is when I talk to people who have this type of view about social drivers of health, is I say that in this case of this person, I said, we can all agree that if you operate on the wrong site surgery should never happen. I mean, that's like a huge cardinal no-no. And by the same token, you would never want to operate on the wrong person, on the wrong patient. If someone has a lot of social needs, they are not going to fare well when you look at the outcomes from surgery, unless you help them deal with things like they're going to need transportation after that procedure. And so I think we all have a lot of work to do to train our colleagues that are allied with us in improving healthcare. And you have a difficult job ahead of you to make sure that people understand the importance of informing patients, learning from them about what their needs are, and then spending a little extra time and tailoring care for those who do have these extra needs. And so I just want to salute you for the work that you're doing, and the fact that you're participating in this workshop, I think is going to help us create materials that we can then share with our colleagues to show the value of doing this. So just wanted to tell that little story there, because I think it's good to remind ourselves about why this is important.
Hey, Dave,
Yeah.
Naomi Pemberton has a question for you. She's got her hand up.
Okay, go ahead.
First, I want to say that was a great story, and I might steal it when I'm talking to providers. Just to let you know. But the two things I wanted to know, you asked what our goals are for today. So my first goal is, how can we use Healthwise to help us identify information that patients need? So as for social determinants of health, if they need, information on housing, transportation, all of those needs, or understanding what this is in terms of like us focusing on things that maybe, we can exchange data. Is this portion of implementation customizable in terms of, what we may need in terms of communicating to patients?
Yeah, I think we will definitely cover ways that you can potentially customize content for all of the patients. Customizing the content for an individual patient, is that what you're looking to do?
Yeah, well, as we are looking through SDoH data, as we track information, there are certain areas that are more impactful than others.
Mhm.
So I would like to have that ability if I'm finding, 60% of the patients are having transportation issues. How do we communicate that information? How do we help? What is it, is it because of demographics? Is it because of insurance? I don't know. So like kind of catering the information provided to the population.
Right. Well, let me open that back up to the group. Do you have thoughts about um, how to identify the most important characteristics of the type of maybe health plans that people are on, or um, the geographic region where they live? What are your thoughts about how you identify those unique characteristics that are important to focus on? Am I capturing your question well, Naomi?
Yes.
Because there are these standard tools, like the Prepare questionnaire, or
Right.
the questions that CMS offered. And I think those are adopted pretty broadly, but maybe there are other things that we need to think about asking within your organization that is unique to your community.
Right. Exactly. And then my second question is in terms of reporting back, are you going to be having a portion of this data reported back on what patients use in terms of SDoH, like information that they search for or look for, or what providers look for? Or...
Yeah, that's the last point here, and measuring the use of the content. And Healthwise has limited ways to do this, especially on the knowledge base side of things. And then we can talk about how you can do this within your systems in the Epic analytics. And then, Sherry has a comment there in the chat if you want to look at that, about using the assessment, and then doing some reporting to see what are the areas of most concern. Is that helpful, Naomi?
Yes, very.
Any
Thank
other
you.
thoughts from folks about how to identify priority areas with your community?
I can say hi, and I'm at the same organization as Naomi, so she might be thinking different things. But I guess what I would say is, we know from screening for the last 6 years almost that it's transportation, housing, and food insecurity. They're always the top three, and I see other people shaking their heads. I don't think that's a big surprise. But to Naomi's point, there are differences among populations where, for example, for pregnant patients, we might see the same three, but also childcare be like a highlighted issue, as you would imagine. And there's sort of different examples. So I think that's one area of customizability for sure that we can, to Sherry's point, certainly use our data depending on the departments and that are screening, like to identify. The other thing about customizability in our system is being able to offer many different ways for clinical teams to share this information. Most of which they'll want to have it be automated in some form or fashion, which, so I think that's something we think a lot about. But then there's teams that we've already started talking to that are like, we want to post these as posters in the waiting room. So, and I imagine you're going to talk about that, like all the sort of different options available for sharing this information.
Okay. All right, so let's get oriented around the content, and then let's talk about how it can be used. So these are the patient instruction titles that were released earlier this calendar year, and these same topics or subject matter areas are also reflected within the knowledge base in the subsequent release that it's in the process of being released right now. And so you can see between these two, it's the same 5 topics, generally about. Here, let me jump over to this other. I will jump over to this other screen, and then we can look at the documents themselves. So let me do that briefly. And so this is too big for everyone? Should I make it smaller? Maybe this is better. How's that for everyone? Is that legible?
It's okay.
Okay. So this is a patient instruction. There's also a knowledge base article about social factors in general. There is a document on screenings for health-related social needs. And then we picked these domains to start with for a variety of reasons about the prevalence of these unmet social needs, the impact on health, the interest and priorities for organizations like yours. So this patient instruction on food insecurity, which was influenced by the Consumer Advisory Board that Healthwise conducted. We recruited a number of individuals who told us about their lived experience. They reflected on an earlier document that Healthwise had produced on food insecurity. That term was confusing to people, and so this is the result of a lot of that feedback. And then we have similar documents on transportation and on housing. And you can see that, from Healthwise's perspective, we have to kind of keep things at a general nationwide level. You are obviously going to have resource information that is much more local and specific to the communities that you're serving. And so you may have some concerns about these high-level nationwide resources not being as appropriate as other things you might be offering. But if if people aren't getting anything, then at least these high-level nationwide resources can be really helpful to them. So any questions at all about this content, about helping people understand what the concept of social needs are and how it impacts their health, helping people understand why is my healthcare organization asking me these questions about my social circumstances, and then specifically about these three domains to help the success of interventions in these three areas. So any questions at all about this content before we get into how we would actually integrate this? Okay, all right. So let's take a moment and get oriented around the different places in Epic where this information might go. And so this diagram, thank you, Laura, for providing this, is an illustration of kind of the two major areas that Healthwise content is integrated into. And not all of you have integrated Healthwise in all these places or have access to this custom content manager that's listed over here. So that you can maybe ignore that custom content manager item, but there are places where patient instructions tend to be integrated into the workflow of very busy healthcare professionals who are providing materials around and during a visit. But one thing not illustrated here is bedside, but that, I kind of put that in the same realm. And then you have things that have to do with outside of care, before care, after care. You have patient instructions in the after visit summaries, but you also have access to Knowledgebase integrated into the patient record. Videos are also available to be integrated into MyChart, and many times those materials are hosted by Healthwise. Sometimes it's integrated into a website that organizations stand up themselves. But just wanted to kind of level set there on the different places in Epic where content is integrated. Anyone not familiar with this or want to talk about it further? Let's see. Okay, I'm gonna keep going here. So this I would like to use this framework to talk about different places where you would like to use this content. And so let's maybe take this first one here. How do people envision using this content before a visit? And what are the places that you would send people to, or that you would send content from before a visit, particularly around the concept of social factors and also the concept of screening?
David, can I share what we're doing at Endeavor Health and where this might be useful?
Yes.
We are offering patient-entered questionnaires for social determinants of health screening, and I think this might be helpful in helping them to understand why we're asking the questions. Patients are very hesitant to talk about the sensitive information, so if we included this as an attachment to the visit up front, I think that would help them be more transparent with what their needs are, and for the care team to be prepared to address them when they come in.
Right. And so how are you doing that? Is it in MyChart?
It is in MyChart. It's something that's built by our Epic analyst team, and they build basically a questionnaire that goes out to the patient once their appointment is scheduled, and they can answer it through my chart, and the answers go back to the care team. So
That's
it's
great.
attached to their visit.
Right. And is there the ability to provide a URL link to the Healthwise content in the knowledge base in the message that maybe links to those questionnaires?
I see my colleagues shaking their head yes, so I will say
Okay,
yes.
that's great. Yeah. And so I'll send this slide deck out. You'll see here on this slide, these are the Healthwise IDs for the different knowledge base documents. And we can help you construct a URL that you can then hand off to your Epic analysts who build those questionnaires so that you could have a link in the message that goes out to the patients. Is that clear?
Yes, that's clear. I think that will be helpful. We also are going live with a cancellation reason that outlines social determinants of health. We're trying to gauge the barriers that
Interesting.
are preventing patients from making it to their visit. So I think this will be helpful.
So when you have a cancellation, you ask the patient the reason for the cancellation in a way that helps you identify, let's say if they have a transportation issue.
Exactly.
Okay, that's great. Laura, any other thoughts about providing education with questionnaires that I may have missed?
No, I think also think about any of your third-party integrations where they can utilize kind of that promotional sort of pre-deliverable, just like you're using with your questionnaires. But if you are utilizing any type of a third party that gives you the ability to send out potentially an unsolicited order, right, where you can attach education, and you have the ability to include a URL in there as well, so that you give access to the information before the visit, and then you can, also include it in your questionnaire, also include it as you move down the pathway of that encounter with the patient, the life cycle with the patient. So just other areas, I think, to make it, again, accessible both online, but also ensure that there's other ways of delivering that content, not only online, because that also can be a barrier as well, right? So.
Okay, so let me read this back to you. So you mentioned third-party integrations, and so that might be a patient
Like a
relationship.
Yeah.
So Zelth or some type of patient relationship management communication platform, right?
Exactly.
Okay. And
Exactly.
then the other thing you mentioned is an unsolicited order.
Yeah. Yeah,
And
so with an unsolicited order, there's not necessarily a specific encounter for that patient, right? So it's more of something that happens with that third party to initiate the delivery of that content. But I'm also thinking of, when you're sending out just some of your mailers as well for communications to patient, any items that you need to send as part of a even, considering what Dave was talking about with that pre-op visit, of including some of that education in there as items to discuss, before that interaction. I think early and often, I know I hear all of the clinicians early and often on that communication. So there's multiple access points and moments where a patient has the option to put their hand up to say, yeah, I need some support here.
yeah, so can people talk about, do you ever print Healthwise materials and mail that to patients? You do, okay. And what's that process like? How do you do that? Do you send a web page to someone that runs a print job, or Maybe you print to a PDF and it goes to a print facility.
David, I can share. For Endeavor Health, we print on the spot sometimes in the visit so that people have something tangible. They might want to take notes on what they've talked about with their care team, or we'll just fold it up and put it in an envelope. But we don't print to a location outside of the office. Typically, it's the in-office staff
Got it.
recognizing the patient has a need for this education, and they'll print it and mail it.
Okay. So let's maybe switch to that middle column there. So during the visit, or almost towards the end of the visit time frame, it sounds like at Endeavor, printing material in the middle, right before or in the middle of, or at the very end of that visit is an appropriate way to give a piece of paper to someone to help them understand what's happening during that encounter. And so with that workflow, like where during the visit is this printing taking place?
I think it depends on the throughput. If there's some type of education, for example, hypertension, it might happen during the visit so they can review the workflow or the process for self-management with the patient, but it's usually accompanying the after visit summary.
Yeah.
But I do want to share that we try to minimize printing. We really tailor it to the patient's experience. We don't want to give them 75 sheets of paper. It's just overwhelming. Also want to be good financial stewards, right? And so that paper ends up recycled on the ground, etc. So most of the time we send it electronically, but if there's a need, we will print with the after visit summary so they have something tangible to take with them with their orders.
Okay.
I would echo the same thing as what Pat said at Montefiore in terms of printing on the after visit summary as needed. The other thing I was going to offer, and I don't want to go left here, David, but I think you and I talked about this, is that I do see a use case for some of this content for sort of staff training or staff scripts for when we have a self-administered questionnaire also, and some of that is done via my chart, and some of it is done, or actually the bulk of it is done in person when the person arrives for their visit. Obviously, this is the ambulatory side, and so I do think it could be really helpful for staff in being able to talk about why we're screening, as well as to if they get some questions and pushback, to even have more content than we've already given them. So that was a use case I thought this could be helpful for as well.
Okay. And so for an after visit summary, what are the reasons why Healthwise does the work of knowledge engineering and applying metadata to these documents is so that when you're in the place inside of Epic, whether it's clinical references or something else, the data that has been entered about the patient for that encounter should drive surfacing appropriate content and making that workflow really easy for the care professional, so they don't have to go looking for content. And what we did was apply ICD and SNOMED and LOINC and lots of other metadata on these documents, so that automatically inside of Epic these things should surface. So in theory, this is how it might work. I put a picture in here of the Epic wheel in the middle. Has everyone seen the Epic wheel? Okay. So in theory, if somebody has filled out a questionnaire before a visit or during a visit, the codes associated with some type of social need, a deprivation, if you will, those codes theoretically are in the record. And so that when a clinician or a care professional brings up the task to attach patient education to the after visit summary or provide it as a printout, it should just show up. And so I think we need to hear feedback about any issues or hiccups if this content that we've created is not readily available in that workflow. then we may have to do some configuration with your integration. We may have to go back and adjust some of the metadata to make sure that it works appropriately. Any thoughts or concerns about that?
Dave, this is Kathleen at Endeavor Health. Hey, that's amazing. So I was under the impression that clinical references was just pulled in on ICD-10 and problem list. So you're saying there's additional capability beyond that should be set up to run?
Well, so there are Z codes within ICD that relate to the very high level domains of social needs. And so what Healthwise has not been able to ascertain, because we don't really have a copy of Epic that we can do testing with. So working with you to determine, okay, when you screen someone and you identify that they have a need, does that Z code get applied to their record? And does that then flow into clinical references so that it can pull up associated content on food, housing, or transportation? I think that's yet to be seen, but in theory, it should just work. But I think we have to verify that.
Okay. Yeah, I have not seen that, but I hadn't tested it. So that's
okay.
We'll test it.
And Naomi, I think you wanted to say something.
Yeah, so that's kind of what I was talking about a little bit earlier about customizing in terms of based on the patient's record history. Are you is Healthwise able to gather that information and customize the health information provided to the patient? I think it's great what Pat was talking about in terms of pre-visit, just kind of explaining what SDoH is, and then but also taking into account, some of the information in the medical record that says, hey, this patient wasn't screened ever. So let me push out a SDoH. Hey, guess what? There's this assessment. Do you want to do it? Then, once they are doing it, then taking that data and saying, hey, we see that you had a lot of issues with transportation. Let me explain, let's explain how we can, help, or how the health center can help you, whatever that combination is. I was wondering if you will be able to do that.
Yeah, so right now, the type of implementation that we've been talking about is in, I guess I would call it like legacy Epic. And so that functionality of knowing that someone has a diagnosis and then surfacing relevant content that relates to that diagnosis, that functionality is in Epic today. In addition to that, Healthwise has developed Fire apps, so has WebMD Ignite, and these things are merging together. And so in the future, if you are all using a Fire app to bring up patient education, it should really function the same way. So the launch of that Fire app will bring in Fire resources, which describe what's happening with the patient, and that should surface information. And then if you haven't screened someone, if you don't have knowledge of what their needs are, then yeah, theoretically you could potentially build some type of capability to send a screening to someone with education. And the Healthwise capability or what Healthwise today offers is content that can be linked to from either an Epic feature or, as Laura mentioned, some type of third-party communication platform. But in general, the legacy Healthwise offering is really reliant on what Epic provides in order to identify who needs what information. Is that helpful? Okay.
Yes, thank you.
All right. All right, so we have about 15 minutes left. Is there anything else about let's say like an inpatient stay and bedside, or things after the visit, or maybe um, programs or campaigns or other materials that you think are needed in order to educate the public about social factors that impact their health? What are other things that we haven't mentioned yet today that we ought to?
David's Kathleen from Endeavor Health again. I'm just thinking at Endeavor, we on the inpatient side are really trying to leverage the education titles by system, and you know, orthopedic, heart failure, you know, and neurologic, you know, kind of our big buckets. And I wonder if lumping this together in an education plan, an education title, which then carries over to my chart for the patient and the proxy after discharge, might be another way we can be sharing this information.
Okay, so what you've done at Endeavor is you have collected titles by department. Am I saying that right?
Yeah, it's just a standard Epic workflow for the education titles.
Okay.
And so building one specifically for social determinants of health, or
Right.
you know, social screening or social health, whatever it were to be called, but kind of
Got it.
consolidating this, because per Joint Commission, nurses have to educate patients. And so this kind of moves it more over into a formal education. I want to teach my patient about this, but it does carry over to my chart, which is the real power.
Right.
And after the discharge, something to think about.
That's great. All right. So because Joint Commission is auditing what nurses are educating patients on, there is a feature that allows you to collect documents under an education plan. So those titles are listed there. And so your idea is to create an education plan around social that would include these titles, and then nurses could be sure to include those, and then it would be reportable, so you could see how often you're doing it, and then it would flow through to my chart, so it would be available to the patient after the visit.
Correct. Or social workers or care just doesn't have to be just nurses. It's anyone on the care team can utilize this. Yeah, you got it.
Okay, so maybe, let's talk a little bit about that. Traditionally, you think a lot about nurses, like a lot of this work of educating patients being very nurse-centric. And many of the conversations I've had over the last couple of years, it's kind of interesting. You were getting more and more into community health and social work activity. And I've heard a little bit of concern about people in the realm of community health work or social care. Those care professionals are not as familiar with resources like Healthwise, and in fact, they may look upon a patient education resource as, oh, that's something for the nurses. And so we may have some professional barriers to overcome there, kind of like I was talking about with the specialty doctors. That maybe we need to make sure that our allies within community health and social work know that they have these resources available to them. Is that an issue that people have seen or are concerned with, or how have you dealt with that if it does exist?
David, this is Pat. I think that's realistic. We've seen it pretty much everywhere, but I think it's up to the organizations to set the standards for their staff. Like, if this is going to be our source of truth for education, then it would be communicating with our team members on all levels, making sure that they know that we trust the content, because that's the biggest thing, is letting them know that it's not outdated, it's up to date, that we trust and are confident in the material that they're providing, and the usefulness to their throughput and their workflows, basically. So right. I think that would be on us to really promote what's being offered.
Okay, and I think one of the issues that might happen is that when you are promoting this material, to individuals who are used to providing very specific localized information, they may say, well, this is helpful about describing the concept of food insecurity, but these resources listed here are maybe not where I want to direct my patient. So perhaps in that case, it would be appropriate to make a customization to the material. So Laura, I'm wondering if we could talk a little bit about what are typical best practices for making changes to HTML patient instructions if you did want to make a slight customization to these materials.
I think that would be helpful to share with us, because I'm thinking about geography specifically. Different patient populations have different needs and resources available by zip code, et cetera. And so if it doesn't apply to that area, we'd really want to customize it to something we think would work, so that patients don't lose confidence in the SDoH screening in totality.
That's
And
good.
I'm so glad, Pat, that you brought that up also around kind of including that zip code. So specifically, as we're thinking about that Epic workflow and how it's presented to the clinician, I think about a couple of areas. So I think about the clinical title and how that patient is getting it presented to them and that search result list. So when I'm thinking about customizing it, I'm thinking about potentially having different versions that within that clinical title, which again is only visible to the clinician, you would include that at the end of that title. So it's about food insecurities for that zip code. And you might have, multiple of those. So yes, it is having multiples of the same content pieces. The way that I would edit this content is before it's loaded into Epic. It would require a HTML editing tool, and we're happy to work with you one-on-one to show you what we would use in order to make that edit, help you with the job age so that it's repeatable. The idea here is so that you would have, again, the ability to customize it, because you would need to do it quarterly. For those of you that have the Healthwise Custom Content Manager, the ability to import it into that Custom Content Manager, make that change, and then publish it out to your different deliverables is an option as well. But I want to address it kind of on that larger scale. So an HTML editor, it sounds a little daunting, but believe me, if I can do it, you guys can do it. So there are just some basics where you can go in and make modifications within the area of text, not going too crazy, but keeping that general information, but then adding those specifics, URLs, contact numbers for that different areas. That being said, I think continuation of your education governance to ensure that you're regularly reviewing those. Again, I would say on a quarterly basis, just to ensure that you're pulling in new resources as well. It's not just about making sure that they're consistent and are being maintained, but as we know, trying to work with your community to get that into a single document and updating it to different entities that are available, within that area of zip code. But again, thinking also about that clinical title so that clinician sees it, there's my zip code, I'm ready to go. Also, as Kathleen, as you're thinking about it too, and talking about those education plans, is within those teaching points, separating it also out by zip code to ensure that you're sort of organizing the content in a way that is streamlining it for the clinician so they will use it, right? And it is customized for that area, that your patients are finding it helpful and it's targeted for their specific needs. And so they also will, look to you as part of that kind of, source of truth area for support to ensure ultimately the better outcome of their health. Right? That's the dream and the goal. So and I know we only have 4 minutes left, but I'm happy to, we'll include in the meeting minutes and the follow-up with the recording is my contact information. So I also have another partner in crime. We call him Mr. Shenanigans. His name is Colin Washburn, that can also help with ensuring that you feel comfortable with editing your content, and again, making sure you have a job aid that meets your needs on how you would maintain it over time.
All right. Well, on the way out here, I want to focus on what you can do to measure this. So this is an example of a data visualization that Healthwise put together with data that was pulled out of Epic Clarity, the analytics feature within Epic. You can work with your Epic IT folks who analyze information and visualize it for you to look at how often is this content being used, and then you can answer certain questions. Who is it going to? Do the people who receive this information, or the organizational units that use education around social drivers, does that translate into higher rates of screening or more successful interventions? And so I think this is one of those things that is important whenever we are launching new types of content, is to understand how it's really helping people. And I'm just looking in the chat here, it looks like Sherry Clay has tested Healthwise showing up inside of clinical references, and indeed it sounds like it works as designed. And then Karen Jean, I think you were asking about how do we reach patients who are not on my chart, if you want to reach people pre-visit. And I think here you may need to create materials that are like posters or some type of real life type campaign to communicate with people. Is anyone doing that? Is anyone producing posters or printed campaigns for people who are not on my chart?
We're in the process of doing that, and I'm happy to share once we have some good materials drafted.
Okay. That's great. All right. Well, I will send out the final report and this deck. Any parting thoughts that people want to share to kind of memorialize where we are in this moment? I personally feel like this is not a moment. This is not a trendy thing, although some people may think that. This truly does feel like a movement. And I thank you for your contributions to this movement. I think it's really important. It's a good comment, Laura, about telephone outreach.
And don't forget about home health. I know everyone, home health, right? That's also a great challenging area for both interviewing patients and delivery of content and having it available, and being able to deliver it in a digital manner. But that's a great area for print packages to have available for home health, but also for home health to work alongside with the clinicians, follow-up caseworkers. As you all know, I know I'm preaching to the choir here, but home health is the one that I just want to cheer for as well, because I think they're super important in this journey for health with our patients as well.
That's great. All right. Thank you, everyone. Really appreciate your participation. I hope that what we produce here is valuable to you and your colleagues. Bye-bye.
Thanks, Dave. Thanks, everyone.
Thank you.
Thank you.